Hi, I'm Dr. Shilpa Verma and I'm a consultant surgeon attached to various hospitals in Noida, and I'm practicing since last 20 years as a consultant laparoscopic and general surgeon to Max and Fortis Hospital. While thinking about gender bias, the very first thought that came across my mind was that had I been a victim of gender bias, probably today I wouldn't be what I am. And fortunately, I had good parents, and I was born in a educated family where I got the best of education, encouragement, and always had the freedom to choose what I wanted to pursue in my life. So, coming to gender bias, this is something which I come across every day as a doctor in the maternity wards. So, there are a lot of celebrations when there is birth of a baby boy, but I see definitely a change in the attitude when there is birth of a baby girl. There's a definite change in the attitude of the father, the relatives towards the baby, as well as towards the lady who has delivered the baby. So the gender bias starts right there. What I feel is poverty and lack of education are the two culprits for this gender bias. And the girl child, as she grows up, she is treated differently than the boy. Uh, the boy gets nutritious diet, whereas the girl usually gets the stale food. The boy is supposed to be the bread earner, so he gets the best of the nutrition, whatever is available in the family, and the girl suffers. So, I've been associated with various NGOs and various institutes, and we are conducting a lot of medical camps, free medical camps, uh, to diagnose uh, anemia, and we come across lots of more number of uh, girls suffering from anemia and malnutrition than guys. So usually these girls suffer from various ailments like worm infestations and protein energy malnutrition, and we are working to uh, improve the health of the girl child, especially these girls. They get married young and uh, become pregnant, and there's a lot of mortality during childbirth. The problem of anemia also worsens in their pregnancy and after the delivery of the child. So these are the various problems as a doctor we come across, and uh, because of lack of education, these girls or these women usually remain dependent on either their parents or after marriage on their husbands or brother or whatever, and they are incapable of taking independent decisions for themselves or for their family. And because of lack of education, even if they get jobs, these jobs are low paying jobs or low skilled jobs. So usually these women uh, lack the power to take any decisions in the family. Mm, Coming to gender bias, as a female surgeon, uh, I've come across a few incidents where, in my earlier days, after passing out as a doctor, when I went in search of jobs in hospitals, uh, I was not considered exactly as an asset being a female surgeon, because these jobs demanded late hours and long hours, working through sickness, and putting your work before your family. So I think one should encourage equality in opportunities to both the genders. So this sort of mindset needs to change. Uh, a female surgeon, a married female surgeon with a family, uh, may not be considered as devoted in her profession as a surgeon as far as putting fair share of work, time, and effort. So I think this conditioning needs to change. I'm attached to various NGOs and various institutions where we are doing a lot of we are conducting a lot of camps and trying to treat anemias, trying to educate girl child and orphans. And what I feel is, I'm definitely not anti men, but I am a pro woman, and I feel very strongly towards issues like women education, women empowerment, and improving health of women. What I feel is that a woman uh, should have a choice, a freedom of choice, and a freedom to make her own independent decisions. And I feel that once a female of the society is strong, then the society becomes stronger. Thank you.